Hi everyone, I'm Ignez. I'm dentistry from Brazil. I'm here today with my children, Maria Clara, that's studying dentistry too. I'm gonna show you my poster that's about non-surgical PDO treat rhinoplasty, aesthetic and functional supports in dental practice. Rhinoplasty with polydexanon treats is a minimally invasive procedure that allows precise shaping and structural support of the nasal trip, based on a sound anatomical principles. Recent studies have also reported functional benefits, such as improved nasal airflow. Within the scope of orofacial aesthetics, this technique represents a safe, evidence-based alternative for dental practitioners performing facial aesthetics procedures. My objective with this poster is to propose a non-surgical rhinoplasty technique using smooth polydexanon threads as an alternative to conventional dermal fillers, with a focus on achieving predictable aesthetics outcomes and potential functional improvements in nasal breathing. I'm gonna show you a case description. I'm gonna talk to you about my patient. It's a 72-year-old female presented with drop in nasal tap and reduced dorsal definition. About the procedure, we'll do the placement of a smooth 1.0 PDO surgical thread using a 18D versus 100 mm cannula. The technique is a lever Victorian approach for nasal tap elevation and dorsal alignment. With an 18G needle, we will mark and create 2 entry points. So we will set the cannula containing the thread toward the nozzle tip. Position it in the superficial subcutaneous plane. While maintaining pressure, the cannula is gently withdrawn and the thread is trimmed with curved incisors, applying light compression. After that, the cannula is introduced at the nasal tip, positioned at the superficial subcutaneous plane. While maintaining pressure, the cannula is gently withdrawn and the thread is trimmed with curved scissors, applying light compression. After that, the cannula is introduced at the nasal tip and advanced through the subcutaneous plane until inserting the prosthesis muscle. So we apply pressure on the cannula, retract, and cut flush with the skin. Repeat as needed until the desired straightening of the nasal hump is achieved. I'm showing you all the materials that I use during this procedure. I'm going to use 18G cannula, 18D needle, smooth PDO surgical thread 1.0, 20 ml lower lock strangle, sterilely drape, needle holder, small curved tip scissors, carpool, local anesthetic with vasoconstrictor, anesthesia needle, sterilized gauze, and sterilized gloves. As results, the procedure produced an immediate enhancement in nasal tap and dorsal definition, achieving a visible lifting effect with natural and symmetrical results. No complications or adverse events were observed. The patient reported high satisfaction with the aesthetic result and noted improvement in nasal breathing. The average procedure time was 1 hour, and the expected duration of results is 7 plus 20 months. In addition to aesthetic improvements, non-surgical rhinoplasty has been shown to positively impact nasal breathing, particularly through tip elevation. Recent studies have documented improvements in airflow and nasal angles, further supporting the functional potential of this approach. The non-surgical rhinoplasty technique with smooth PDO threads has proven to be an innovative, safe, and efficient alternative for nasal remodeling, with the potential for a positive impact on both aesthetics and the patient's respiratory function.